Today we are going to study the dissected part of the upper limb, and we are going to study the upper limb structures, we are going to study the muscles and nerves and vessels. So upper limb dissected part we are going to study today. This is upper limb shoulder region where you can see the deltoid muscle. This is the deltoid muscle where deltoid tuberosity it is inserted, and you can see this is the deltoid muscle. Multipinnate muscle which is covers the shoulder joint and almost all shoulder region, and this is the one which is we call as a deltoid muscle. Next, on the anterior compartment of the arm muscle is a biceps muscle. This is the biceps muscle which is having the long head and short head, and two heads of the biceps we are going to get. Below the biceps we are going to get the brachialis muscle. This is a brachialis muscle, and we have on the axillary region coracobrachialis. So anterior compartment of the arm muscle are biceps, short head and long head, brachialis, and we have the coracobrachialis. These are the anterior compartment of arm muscle. Going to the posteriorly, where the posterior compartment of arm muscle is triceps. So it is having the most of the long head, and we have the lateral head and medial head, and this is the triceps muscle. That is the posterior compartment of arm muscle. That is the triceps. So arm muscle anterior compartment we have studied, posterior compartment of arm muscle is triceps. So this is the deltoid. So this is all muscles of the arm and shoulder region. The forearm extensor muscles are, we are going to get this is a brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, and this is the extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris. So these all are the superficial muscles of the extensors of the forearm muscle. So once again to revise, this is a brachioradialis which is forming the lateral boundary of the that is a cubital fossa. Then we have the extensor carpi radialis longus, extensor carpi radialis brevis. This is the extensor carpi radialis brevis, and this is the extensor digitorum where you can see extensor digitorum, extensor digiti minimi, extensor carpi ulnaris. So these all are the forearm muscles of the extensor compartment. Here you can see we are going to study the flexures of the forearm muscle. In this you can see the pronator teres muscle. This is the pronator teres. Then we have the flexure carpi radialis, and we have the palmaris longus. This is the palmaris longus. Then flexure carpi ulnaris. Then we have below flexure digitorum superficialis. This is the flexure digitorum superficialis. So these all are the muscles of the forearm, that is the flexure compartment. This is the area of the anatomical snuff box where you can see the boundaries forming the anatomical snuff box. Those are the abductor pollicis longus, extensor pollicis brevis, and one muscle which is we are going to get extensor pollicis longus. So anterior boundary are formed by the anatomical snuff box, abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus. So this is the triangular depression on the lateral side of the wrist joint is called as that is the anatomical snuff box, which is we call as a triangular depression on the lateral side of the wrist joint. That is the anatomical snuff box. Roof is formed by the skin, superficial fascia, and the cephalic vein, and deeper floor is formed by the bones, carpal bones, and content of the anatomical snuff box is the radial nerve, radial artery, and we have the cephalic vein. Here we are going to study the deep dissection of axillary region. In the axillary region you can see this is the one which is a structure we call as an axillary artery. So this is the one which is the axillary artery continues as a brachial artery. Next to that, deeper dissection in the axilla, we are going to get this is a median nerve. So this is the median nerve, and this is the one which is axillary artery continues as a brachial artery, and we are going to get below is, which is we are going to call, this is the axillary vein. So we are going to get the axillary vein that is a continues above by the basilic vein, and this is the one which is a below structure, which is we call as this is a ulnar nerve. So this is ulnar nerve, and we are going to get this axillary artery continues as a brachial artery, and this is the one structure which is a median nerve. Then this is a muscle which is a biceps. In the biceps, which is supplied by the biceps is by this is a musculocutaneous nerve. So this is we call as a musculocutaneous nerve, which supplies the biceps, and below this is a brachialis muscle. So this is a musculocutaneous nerve. And most laterally when we go, we are going to get most laterally of the arm and content of the cubital fossa, that is we call as this is a radial nerve. So that this is a radial nerve. Then we have come across this is the musculocutaneous nerve. Then we have got this is a median nerve. So median nerve, then this is a ulnar nerve. So repeat all the structure of the arm region nerves. This is one which is ulnar nerve, and this is a median nerve, and this is a musculocutaneous nerve, and this is a radial nerve. So these all are the nerves of in the deep dissection of the axilla and arm region. This is the area of cubital fossa, where it is a triangular muscular area situated in front of the elbow joint, and this is bounded by the laterally by the brachioradialis muscle, medially by the pronator teres. So base is formed by the imaginary line passing on the epicondyle of the humerus. Apex is directed downwards. Boundaries are laterally by the medial border of brachioradialis, medially by the pronator teres, and base is formed by the imaginary line passing through that is the epicondyle of the humerus. And what are the contents of we are going to get the cubital fossa. Here this is a brachial artery, which is a main content, which is divides into a radial and ulnar artery. Then main content which is we get as this is the one median nerve, which is you can see this is a median nerve, and this is a brachial artery which is divides into or terminates into a radial and ulnar artery, and tendon of biceps brachii we are going to get, and we have the radial nerve. This is radial nerve. All these are the contents of we are going to get the cubital fossa. This is all structure cubital fossa, its boundaries and contents of the cubital fossa. So this is all about the cubital fossa. We can see the radial nerve in the forearm, where we can get as one of the content of the cubital fossa, and which is continues as one on the course in the forearm. So radial nerve in the forearm, you can see this is the radial nerve, where you can see this is a brachioradialis, and we are going to get the radial nerve in this. Then we have here flexor carpi radialis, then we have the palmaris longus, and this is a flexor carpi ulnaris. Then below this flexor digitorum superficialis. So these all are the muscles of the forearm. This is the back region, where we can see the upper part of the back region, dissected part. In this you can see the most important back upper part is covered by the one muscle known as a trapezius. This is a muscle which is extending from the superior nuchal line to the T12 spine, so that it is a superior nuchal line extending back of the neck region, then it is extend till the attachment origin T12 vertebrae. So that one side when you see the trapezius, it is like a triangular in shape. So two triangles when joined, it forms the trapezium. So that name of the trapezius is given when two triangle, right and left triangular in shape muscle joins in the midline and forming the trapezium. So that trapezius is muscle named. So this is the one area where you can see this is the trapezius. Below the trapezius you have that is a rhomboidus major, rhomboides minor and levator scapulae. These are the muscles covered under the trapezius. Next to that, when you go to the scapular region, we are going to have the infraspinatus muscle and supraspinatus muscle. This is supraspinatus and this is infraspinatus muscle, and this is the latissimus dorsi. So you have to remember latissimus dorsi. And here one triangle space which is we get, that is we call triangle of auscultation. Back muscles are not covered by this region, so that triangle of auscultation. We can keep the diaphragm of stethoscope and hear the respiratory sound, heart sound and swallowed liquid sound in this region. So this is the one which is we call as an auscultatory triangle, which is bounded medially by the lateral border of trapezius. Laterally we are going to get medial border of scapula, inferiorly by the upper border or upper part of the latissimus dorsi muscle. So inferiorly latissimus dorsi, and we have laterally medial border of the scapula and medially lateral border of the trapezius. Within this area we call as a triangle of auscultation. What is the significance? This area is not covered by the back muscle, thick muscles, and here on the both the triangular space muscle, here we can hear the respiratory sound by keeping the diaphragm both right and left side. So right and left side we can, and on the left side we can hear the heart sound properly, and swallowed liquid sound also we can hear on this region on left side, that is a triangle of auscultation. So this is a back region, latissimus dorsi. This is a paralysis of latissimus dorsi causing that is the winging of scapula. So this is one which is we call as a latissimus dorsi. So these all are the back region muscle. Most important, trapezius, that is below that rhomboides major, rhomboides minor and levator scapulae. We have here, this is a supraspinatus muscle, infraspinatus muscle, and this is a latissimus dorsi. So this is a back region where it consists of these following muscles. This is a dissection of the hand where we can see the intrinsic muscles of the hand. In the intrinsic muscles of the hand, there are 20 muscles which we are going to get in the intrinsic muscles of the hand. 20 muscles are grouped, each group containing the 4 muscles, so that 5 groups we are going to get. So these groups we call as a thenar muscle, and this is a hypothenar muscle. And we have in this 4 palmar introsi, 4 lumbrical and 4 dorsal introsi. So that we are going to have the total 20 intrinsic muscles of the hand. So in the hand region, we are going to get the first one, abductor pollicis brevis, one muscle, and flexor pollicis brevis. Then below this we have the opponens pollicis brevis. Then we have the adductor pollicis. So 4 muscles of the thenar are we are going to get the abductor pollicis brevis, then flexor pollicis brevis, then deeper we have opponens pollicis, then adductor pollicis. Then hypothenar muscles, which we can see there also hypothenar muscle. One is we are going to get the abductor digiti minimi, then we have flexor digiti minimi, opponens digiti minimi and palmaris brevis. So all these are the hypothenar muscle. So thenar muscle, hypothenar, thenar muscle which is indicating towards the thumb, those are with the pollicis, and digiti minimi, hypothenar, which indicates the little finger. So in the middle we have that is the parts which is 4 palmar introsi, 4 dorsal introsi and 4 lumbricals in the deeper dissection of the hand. So this is one which is we are going to see the muscles of the hand, deeper section of the hand, which is showing the thenar and hypothenar muscle, 4 palmar introsi, 4 dorsal introsi and 4 lumbricals. This is the dissection and intrinsic muscles of the hand.